Hi guys, we are going to continue chapter 45. We finished the cardiovascular system and we're moving on to respiratory and lymphatic disorders. So let's see, you're going to be on your PowerPoint slide 17 and you will need your book. All right, so as we learned in the past, hemorrhage is an excessive loss of blood in a short amount of time, okay? Viral hemorrhagic fever, or VHFs, are a group of illnesses caused by viruses. Some VHFs cause mild illnesses, others are severe and life-threatening. They can affect many organs, damage blood vessels, impair the body's ability to regulate itself, and may cause a hemorrhage. All right. The natural reservoir or the host for these viruses is an animal or an insect. Things like rats, mice, mosquitoes are examples. The viruses are usually only found in areas where the host lives. Humans are infected from contact with the infected host. With some VHFs, the person can then spread the virus to others and cause an outbreak. There is no cure or drug treatment for most. Ebola was first discovered in Africa in 1976. Ebola, or Ebola hemorrhagic fever, is severe and deadly. VHS caused by the Ebola virus. Okay. Signs and symptoms of Ebola can appear 2 to 21 days after exposure. Usually symptoms appear within 8 to 10 days. Ebola signs and symptoms include a fever greater than 101.5, severe headaches, muscle pain, weakness, diarrhea, vomiting, abdominal pain, hemorrhage, bleeding from the eyes, ears, nose, mouth, and rectum, raised and bleeding rash that covers the body. Ebola is contagious once symptoms appear. The virus is spread through direct contact with blood or body fluids, including but not limited to saliva, mucus, vomit, urine, feces, sweat, breast milk, and semen. Contaminated objects such as needles and syringes can spread it, and infected animals, their blood or body fluids, or their meat. Ooh, so if you eat an infected animal, yikes. Okay, so transmission, the virus enters the body through non-intact skin or mucous membranes like the eyes, nose, and mouth. So if there's a breakage in the skin, it can enter that way also. Ebola is not spread through the air, water, food, or insects. Ebola has no cure or vaccine. Treatment involves IV fluids, oxygen, and treatment of the complication that it produces, okay? Blood or platelet transfusions may be needed. Let's see. Preventing the spread of Ebola. Health team must prevent the spread of infection. Full personal protective equipment, or PPE, is required to enter the person's room. At least a gown, a mask, goggles, or face shield, and gloves. Hand hygiene, standard precautions, transmission-based precautions, and bloodborne pathogen standards are followed. The person has a private room. PPE is carefully removed and discarded to prevent contamination. Disposable equipment is best. Careful cleaning, disinfection, and sterilization are needed for reusable equipment. The respiratory disorders. The respiratory system brings oxygen into the lungs and removes carbon dioxide from the body. Respiratory disorders that interfere with this function and threaten life include COPD, chronic bronchitis, asthma, sleep apnea, influenza, pneumonia, and tuberculosis. Chronic obstructive pulmonary disease, or COPD, involves two disorders that interfere with the exchange of oxygen and carbon dioxide in the lungs: chronic bronchitis and emphysema. Risk factors for COPD include cigarette smoking, which is the most common cause, Okay, so cigarette smoking is the most common cause. Pipe, cigar, and other tobacco. So all of those are the most common cause. Um, or exposure to secondhand smoke. Okay, so if you live with somebody that smokes, you're smoking. Okay, if a child is living in a home where somebody smokes, they're smoking. Not smoking is the best way to prevent COPD. COPD has no cure. COPD affects the airways and alveoli. Airways and alveoli become less elastic. The walls between many are destroyed. Airway walls become thick, inflamed, and swollen. Airways are clogged by excess mucus secretion. These disorders obstruct the airflow. The lung function is gradually lost. With COPD, less air gets into the lungs and less air leaves the lungs. Okay, so there's not a lot of exchange there, which we need to fill up, get the oxygen to all of our body parts and organs, etc. Okay, so tell me, what is the most common cause of COPD? Is it allergies, smoking, being overweight, or a high sodium diet? What do you think? Smoking. All right, let's move on. Okay. Chronic bronchitis occurs let me look here. Chronic bronchitis occurs after repeated episodes of bronchitis. So a person gets bronchitis over and over and over, it becomes a chronic condition. Okay, bronchitis means inflammation of the bronchi. Smoking is the major cause. Surprise there, right? Infection, air pollution, and industrial dust are risk factors. Smokers' cough in the morning is often the first symptom. At first, the cough is dry. Over time, the person coughs up mucus. Mucus may contain pus. The cough becomes more frequent. Mucus and inflamed breathing passages obstruct airway or airflow into the lungs. The body cannot get normal amounts of oxygen, and then the person has difficulty breathing and gets tired much more easily. Treatment involves the person stop smoking, oxygen therapy and breathing exercises like we already learned how to do, and respiratory tract infections are prevented. If one occurs, the person needs prompt attention. All right, emphysema. In emphysema, the alveoli are enlarged and become less elastic. As a result, some air is trapped in them and when exhaling. Over time, more and more of the alveoli are involved. Oxygen and CO2 cannot get exchanged properly, and the air gets trapped in the lungs. Smoking is the most common cause. Air pollution and industrial dust are at risk factors also. The person has shortness of breath and coughing. Trapped air is not exhaled. The person develops a barrel chest. So go to page 732 because I really want you to see what a barrel chest is. Okay, there's a figure at 45.9, and that is what barrel chest looks like on an emphysema patient. And I've seen that over and over and over. Okay. At first, shortness of breath occurs when they're exerting. So if they're doing something strenuous, maybe not too strenuous, they start to have shortness of breath. Over time, they are just short of breath, even at rest. Sputum may contain pus. Fatigue is common. The person works hard to breathe in and out. The body does not get enough oxygen. Breathing is easier when the person sits upright and slightly forward. So in a forward position, okay? Treatments, the person must stop smoking, respiratory therapy, breathing exercises, oxygen, and drug therapy. I think I talked to you guys about the hardest patients when I was a hospice nurse to mentally deal with was somebody who was on hospice for emphysema, because to me it was like, I put it to being like drowning, you know, that like you're drowning for forever and ever and ever. You're never coming up from underneath that water. You feel like you're suffocating all the time, and that's an awful way to go. All right. With asthma, the airway becomes inflamed and narrow. Extra mucus is produced. Signs and symptoms are mild to severe and include shortness of breath, wheezing, coughing, pain, and tightness in the chest. Asthma is usually triggered by allergies, things like pollutants, smoking, secondhand smoke, respiratory infections, exertion, and cold air. I'm going to stop you there, and I want you to think about this. It's very it's proven that children who are around people who smoke, even if they're not smoking right there with them and it's on their clothing, can trigger asthma in children. Okay, so we need to really be aware of exposing our children to secondhand smoke, either being on clothing or in the air. Okay, think about it. If your child is outside and you're smoking inside, it's getting into the carpet. Toddlers are on the floor walking, crawling around, etc. We've got to clean up the air for our children. Just my little 2 bits here. All right. Sudden attacks. Asthma attacks can occur. In a sudden attack, there's shortness of breath, wheezing, coughing, rapid pulse, sweating, and cyanosis. The person is gasping for air and is very frightened. Fear makes the attack worse. Asthma is treated with drugs. Severe attacks may require emergency care. Repeated attacks can damage the respiratory system. I'm sure every one of us knows somebody with asthma. Okay. Sleep apnea. Sleep apnea are pauses in breathing that occur during sleep. Pauses that last for a few seconds to even over a minute. They can occur many times during sleep. The most common cause is blockage of the airway. So obstructive sleep apnea is during sleep, the muscles in the throat relax and soft tissues that collapse, closing the airway down. So they're laying flat on their back, the soft tissues start to collapse and they have periods of not breathing, okay? There's also central sleep apnea, which is less common. This occurs when the brain does not send signals to the muscles to breathe. Some persons have both obstructive and central sleep apnea. And over time, it can cause damage to the heart. All right, signs and symptoms of sleep apnea include pauses in breathing during sleep, loud snoring, waking during sleep with a gasp or shortness of breath, difficulty staying asleep, daytime sleepiness, headache in the morning, dry mouth, or sore throat after sleeping. Some treatments for sleep apnea include mild sleep apnea, lifestyle changes, weight loss, quitting smoking, and avoiding alcohol and sedatives before sleep. More severe cases, they need surgery, they need positive airway pressure or a CPAP or a BiPAP machine. Continuous positive airway pressure is the CPAP. It involves a mask attached to a pump. Air pressure is forced through the mask, keeping the airway open. The same amount of pressure goes through the mask when the person inhales and exhales. In a BiPAP or a bi-level positive airway pressure, this involves a mask to keep the airway open, but the amount of pressure changes when the person inhales and exhales. The change in pressure is more comfortable for some people. Okay, here's a question for you. Which is the least likely to help the person with sleep apnea? Weight loss, quit smoking, avoid alcohol before sleep, or sleeping on the back? Which is the least likely to help? The answer to that one is sleeping on the back. So sleeping on your back, if you have sleep apnea, is going to make the symptoms worse. Many have to actually elevate the head of the bed a little, okay? All right, let's talk about influenza. It's a respiratory infection caused by viruses. Older persons are at risk. So review, let's see here. Let's go to 733. And you can see in the box there about older folks. It says older persons may not have the signs and symptoms listed. Okay, so their symptoms may be different than what our symptoms may be if they have influenza. They might have changes in behavior, or their mental status might change. They might be a little bit more confused, that kind of thing. You might see actual worsening of other symptoms of their other health problems. So if they've got, diabetes or things like that, those symptoms of those diseases might be worse. Um, the body temperature might be below normal range. They might have fatigue and decreased appetite and fluid intake. Okay. Treatment, or pneumonia is a complication of the flu also. Okay. Treatment involves fluids and rest, drugs ordered by doctors for symptom relief and to shorten the flu episode. Coughing and sneezing spread flu viruses. Follow standard precautions. The flu vaccine is the best prevention. The flu season is November through March. With treatment, most people are better in about 1 week. Okay. So let's kind of compare. Some people don't really understand what the difference between flu and a cold. So let's go on page 733 and kind of compare what the differences are between the two. Okay, so when we're talking about fever in a cold, usually you don't get a fever with a cold. With the flu, you do get a fever, and it's usually anywhere between 100 to 102, okay? And it can last 3 to 4 days. Headaches and colds are rare in flus. They're very common. General aches and pains, you might have slight with a cold, but you definitely have them with of the flu, and sometimes they're severe, right? Fatigue and weakness. Sometimes you get that with a cold. Usually you do get that with the flu, and they can last up to 3 weeks. Okay. Extreme exhaustion, really shouldn't see that with a cold. Usually you do get that with the flu, especially at the beginning of the illness. Stuffy nose, very common with the cold, sometimes with the flu. Okay. Sneezing, usually with the cold, and sometimes with the flu. Sore throat, common with the cold, sometimes with the flu. Okay. Chest discomfort and cough. With the cold, of course, you're going to get a mild to moderate hacking cough. With the flu, it is common, and it can be quite severe. Complications. So with a cold, you might get a sinus infection, a middle ear infection, or asthma. With the flu, you might get bronchitis, a pneumonia, and it can actually worsen other chronic conditions. It can be actually life-threatening. So, we're seeing that right now with the COVID, right? So, folks probably who are going to take this course in the fall, we're going to talk a lot more about the COVID. But I think we're all pretty educated right now on what's going on. Okay, let's move on. All right, so the Centers for Disease Control, CDC, okay, recommend the flu vaccine for persons who are 6 months to 4 years of age, are 50 years of age and older, okay? They recommend it for people who have chronic problems like heart, lung, liver, and kidney disease, somebody who has diabetes, if you have immune system, nervous system, or blood disorders, are pregnant or will be pregnant during the flu season, are 6 months to 18 years old and receiving long-term aspirin therapy. So if you're in a nursing home or long-term care facility, they recommend the residents have that. If you are American Indian or Alaska Native, if you are obese, if you are in close contact with children under 5 years of age, especially those in contact with children under 6 months. So if you work in a daycare, for instance, or if you're in a preschool kind of situation. If you're in close contact with adults 50 years of age and older, so if I were working in a nursing home, it was probably recommended that I also have the flu vaccine. They recommend that all healthcare workers have them, and that's why we recommended that you guys have them, because when you're going to be doing your clinicals, you're going to go in and out of hospitals and other facilities where it may be, you may be more prone to pick it up. Also, who have contact with persons at high risk or flu-related complications. Okay, so these are all persons that should get the flu vaccine according to the CDC. Okay. Okay. Enterovirus D68. So can cause mild to severe respiratory illness. The virus is found in saliva, mucus, and sputum. Coughing, sneezing, and touching contaminated surfaces, and then touching the eyes, nose, or mouth can spread this infection. Sound familiar? All right, so we see this more in infants, children, and teenagers at a higher risk for the illness. Okay, children with asthma become very ill. Signs and symptoms include fever, runny nose, sneezing, coughing, body aches, difficulty breathing, and wheezing. So there are no vaccines to prevent the enterovirus. To protect yourself and others from infection, wash the hands often with soap and water. Avoid close contact with sick people. Cover coughs and sneezes. Avoid touching the face with unwashed hands. Clean and disinfect surfaces. Stay home when ill. And treatment involves drugs for symptom relief. So that sounds familiar with what we're going through right now with the coronavirus. So I guess we should be doing that no matter what, right? All right, I think I have a question for you. All right, who is at higher risk for the enterovirus? A, infants and children, B, healthcare workers, C, the elderly, or D, persons who smoke. What do you think? It is infants and children. All right, I'm going to pull up here something real quick. I wanted to share with you guys before we move on. Let me just make sure what's next here. Okay, before we move on, I do want to share something that you might not know regarding the coronavirus. Okay, I'll go through this very quickly. And if you would like me to forward this, I will to you. All right, so let's talk real quick about the virus that you may not know. The virus is not a living organism. It's a protein molecule, DNA, that's covered by a protective layer of fat, okay? And it can be absorbed in the nose, the buccal mucosa, and it changes their genetic code, okay? But it's not a living organism, and it is not killed, but it decays on its own. So it's not, we're not killing this DNA mutation, but we are, it actually disintegrates, okay? It decays. And it decays depending on the temperature, humidity, and the type of material where it lies, okay? It's very fragile, and it's protected by that fat. So what they're saying is washing your hands and soap really break down that fat and get rid of it, okay? So washing your hands for those 20 minutes, or 20 seconds, 20 minutes, wow, 20 seconds. And the more the foam, the more it's breaking down that fat. So heat melts the fat, so that's why warm water when you're washing your hands. Alcohol above 65% breaks down the fat and dissolves all that fat around it. Any mix with 1 part bleach and 5 parts water will break down that fat around it and break down that that DNA that they're talking about. Okay, oxygenated water helps soap and alcohol and chlorine. So peroxide is really good to break it down. Antibiotic creams do not do anything to it. They're saying you don't want to shake clothes around that might have been contaminated. This thing will live on fabrics for 3 hours, copper and wood for 4, cardboard for 24, metal for 42, and plastic for 72. So remember that. They also say don't take a feather duster and dust around, because then you shake it into the air, okay? They also need moisture to stay stable, and they love darkness. So we need to have dehumidified air, dry, warm, and bright environments. Okay. UV lights can break down the virus protein. The virus cannot go through healthy skin. Okay, so if there's no skin breakdown on you, it's not going through your skin. Vinegar is not a useful, it is not useful to break down any of the layer of the fat. They were saying there for a while when nobody could find hand sanitizer. My sister from California even said this. She said to use vodka. Evidently, the vodka is not over 65%. Okay. Listerine, if it serves, is 65% of alcohol. So there you go. The more confined the space, the more concentration of the virus there can be. So more open and ventilated things are, the less it's going to be. Okay. You have to wash your hands before touching mucosa. Okay. Food, locks, knobs, switches, remote controls, cell phones. I think that we're spreading this thing on our cell phones. I've said that from day one. Every one of us have cell phones. We take them everywhere. We're moving them from one environment to there. Are we wiping them down with an alcohol swab? I hope so. I hope you guys are doing this. Think about that. That phone goes everywhere. Think about what the world has in common. Phones. All right. Computers, desktops, and TVs, wash them down. Okay. What else do I want to tell you? They're telling you to keep your nails short. This is all through the Johns Hopkins post. So if you want to look at it, I would go to the Johns Hopkins site and just kind of look up things if you want a little bit more information. This article was an eye opener for me for a few things that I didn't know. So it was quite educational. Okay, so we talked about that. Let's move on to pneumonia. Okay, pneumonia is an inflammation and infection of the lung tissue. Affected tissues fill with fluid. Oxygen and carbon dioxide exchange is affected, so that slows down that exchange, okay? Bacteria, viruses, and other microbes are causes. Microbes reach the lungs by being inhaled, aspirated, or carried in the blood to the lungs from an infection in the body. Children under 2 of age and adults over 65 are the largest at risk. Okay. Things that increase your risk. Boy, that smoking sure comes up a lot, guys. I hope you're not smoking. And I'm talking vaping too. Aging, stroke, bed rest. So remember we talked about folks who are in bed rest for a long time. They are really at risk for developing a pneumonia. Immobility, that's why. Chronic diseases, tube feedings, because they may aspirate, okay? Treatment may include drugs for infection and pain, increased fluid intake to treat fever and thin secretions, IV therapy and oxygen, semi-Fowler's position to ease the breathing. Remember, lying flat's not good. Onset may be sudden. The person's very ill. Thin secretions are easier to cough up. Rest is important. We're going to use standard precautions. Isolation precautions are used depending on the cause. Mouth care is important, and frequent linen changes are needed because fever and they would be perspiring a lot. All right, next question. Which position eases breathing in the person with pneumonia? Supine, prone, semi-Fowler's, or Trendelenburg's? What do you think? Semi-Fowler's. This is no fun when I can't see you guys actually click in, huh? All right. Tuberculosis is a bacteria infection in the lungs. It is also occurs in other body parts. If TB is not treated, the person will die or can die. TB is spread airborne droplets with coughing, sneezing, speaking, singing, or laughing. Those who have close, frequent contact with an infected person at risk, nearby persons can inhale the bacteria. Risk factors include living in close, crowded areas, age, poor nutrition, and HIV. TB can be present in the body but not cause signs and symptoms. An active infection may not occur for many years. Only persons with active infections can spread the disease to others. Chest x-rays and TB testing can detect the disease. Signs and symptoms include tiredness, loss of appetite, weight loss, fever, and night sweats. Coughing and sputum increase over time. Sputum may contain blood, and chest pain can occur. Treatment involves drugs for TB, standard precautions and isolation precautions. The person covering his or her mouth and nose with tissues when sneezing, coughing, or producing sputum. Flushing tissues down the toilet, placing them in a biohazard bag or in a paper bag to be burned. Hand washing after contact with sputum is essential. Well, of course. All right, tuberculosis is spread by A, contaminated drinking water, B, contact with wound drainage, C, coughing and sneezing, or D, fecal oral route. What do you think? Coughing and sneezing. All right. The lymphatic system. So the lymphatic system drains extra fluid from the tissues. It helps fight infection and absorbs and transports fats, okay? Lymphatic disorders that affect these functions include lymphedema and lymphoma. They're two different things, okay? So lymphedema, I know a lot about that. Of course, I keep talking about my mom. Poor mom had everything, didn't she? She had that. So lymphedema is a buildup of lymph in the tissues causing edema or swelling. It occurs when there is a blockage or damage to the lymph system. Causes include cancer, infection, surgical removal of lymph nodes, scar tissue from radiation therapy or surgery, or absence or abnormal lymph node present at birth. Lymphedema usually affects an arm or a leg. Daily activities are often affected. Other body parts can be involved. The person may have a tight or heavy feeling and have trouble moving the body part. Thickening of the skin, pain, itching, or burning, and hair loss are also common. Damage to the lymph system cannot be reversed. Okay. Treatment for lymphedema includes elastic garments or bandages. Pressure applied by elastic garments or bandages help move fluid and prevent fluid buildup. Okay, so we did talk about that past. You might want to watch the skills video also again on putting on the compression stockings. Okay, exercise, good skincare, and massage therapy can help. The goals are to control swelling, decrease pain, improve movement and use of the body part, and allow for daily activities. Now, lymphoma, on the other hand, is cancer involving cells in the immune system. All right, the lymphocytes. Lymphocytes are a type of white blood cell that protects the body from infection. They're found in the lymph nodes and the lymph tissue. In lymphoma, these cells do not function normally. There's two types, Hodgkin lymphoma and non-Hodgkin. They differ in the types of cells involved and how they spread and how they respond to treatment. Lymphoma begins with an abnormal lymphocyte. The abnormal cell divides and makes more abnormal cells, okay? These cells cannot protect the body. They also live longer than normal cells. Then a mass of abnormal cells develop into a tumor. I have a client right now who has a mass in his abdominal area that, is a mass of these cells. And he's having chemotherapy for that, but it's just a mass of these abnormal cells, and in his case, they'll never actually go away, but they can control the size of those abnormal cells, okay? Signs and symptoms of lymphoma are also caused by other health problems or infections. Tests are done for diagnosis, and treatment may include chemotherapy, radiation, or both. Psychological, social, and spiritual support is needed for this. Okay, so we have one more thing to cover, guys. So when checking blood pressure, you should apply the cuff to the arm that is easiest for you to reach. B, deflate the cuff slowly when using an arm that is swollen. C, report blood pressure of 110/70. Or D, ask if the person has an arm that should not be used for blood pressure. What do you guys think? It is D. So never apply a blood pressure cuff to an arm or leg that is at risk for lymphedema. For instance, a woman's had a mastectomy. Let's say she's had a mastectomy on the right side, which probably involved removing lymph nodes from underneath the arm, okay? So this sets this arm up for having lymphedema. So you should never take the blood pressure in this arm. So you want to always ask the patient when you walk in, is there any reason not to take blood pressure in both of your arms? So you want to ask that question. So, all right, so that's the lecture. Like I said, it has been broken down into 2 sections. We did the cardiovascular first, and then and then the rest here. So I will see you for the next lecture. Have a great day.